Thank you so much for that. This is normally the time where some people have to sign off and head out, so we do have a half an hour left. But if you have to leave early, AsherCorps has just posted the link to the evaluation survey, so please take a couple of minutes to fill that out. And before we go to questions to the speakers and some question-answer period, I do want to get some feedback from everyone that's in the audience. And so I put up a poll question now, thinking to, and I need to advance the slide here first, thinking to what Pippa was referring to around the spheres of influence. What does our audience think about actions that can be taken at the community level of the sphere? Sorry, I'll move this so it's a little bit easier to see. We really wanted to get at what, and then I'll stop moving it around, sorry. We really wanted to get at what we could do after the webinar today. What are some of the actionable take-home things? You know, we're often hearing from our audience that they really love the concepts, but they need to know what to do when they get back to their jobs. So this is textable responses. If you can type your response in here for any ideas that you've got, we'd really love to hear from you in the audience. And I'll leave it up, and I'm going to move it again on you to be annoying. I'll leave it up so that you can see the responses as they come through. And as people are responding, I thought maybe we could start with a couple of the questions. So I'll just ask Mariette, Marni, and Pippa to all be unmuted on your phone. And I'll go way back to the beginning. We had a question from Jan Douglas. Is oral health education included in the HBVP? And that was when Marni and Mariette were speaking. So is oral health education included there?
I think probably you mean, is it included in the information that is sent out to women with the monthly check? That I don't know. I know that breastfeeding initiation is there. I know there's information about nutrition. Mariette, do you know offhand whether they include information about oral health?
You know, I don't remember seeing it, and I don't have them in front of me. But, you know, I will certainly pass that on. It's incredibly important. Yeah. So I'll double check that. I'm not sure.
That's great to pass it on, though. I mean, that's really good feedback for to clarify. So another question for Marni and Mariette, and I think it was back when you were talking about when does the Manitoba Healthy Baby prenatal benefit improve outcome? What were the confounders that were accounted for? I think that was when Marni was speaking.
Yeah, and I saw that question and thought, oh yeah, that's a big question. And you know, in a short presentation, you can't cover everything. But
I know.
As part of our repository of data, we've got this fantastic resource, which is called the Families First Screen, that is given to, or is supposed to be given at a public health nurses in Manitoba visit families with newborns within about a week of the newborn being discharged. And during the course of that visit, they fill out a screen which has about 40 items about family risk factors. And so it's a really rich source of information about whether mom smoked during pregnancy, drank during pregnancy, is this a single mom, you know, is there support for this family, a whole bunch of really important confounders to be able to control for. And we were able to use a method, you know, and not that I want to go into great detail. I actually put the paper up when I was talking about it, and if anybody wants to see some of the papers that we've published, you can just email me and I'll send them to you, or email Diane, or whatever works. Sure. But we used inverse probability of treatment weighting is the mathematical or statistical adjustment we were able to use to adjust for the differences that there may be between women who received the prenatal benefit and those who didn't.
Okay. Well, that's great. And I want to say that I'm noticing we have lots of responses here on that polling question, and this is great. I'll leave it up for a couple more seconds, and certainly we can share this information with participants if you're interested in the next few weeks, just let us know. So I'm going to switch to a question for Pippa, and I think it was around when you were at slide, I tried really hard to keep track of what slides it was. It was around slide 45 and 46 when you were looking at the distribution of vulnerable children across neighborhoods. And there was a question, is there an explanation for the section that has the low socioeconomic status and very few vulnerable kids? Does that make sense?
Yeah, it does. An explanation might be too strong, but I would say that there are some hypotheses about why we see areas with low socioeconomic status, low socioeconomic status and also low vulnerability. It's not causal. It's more correlational. But we think that in those places what we see is, well, obviously a reasonable level of service, an adequate level of service. In those places where there's no inadequate service, you wouldn't see the same effect. So definitely sufficient programs to support children and families. But we also see in those places higher degrees of intersectoral or collaborative work between the professionals who support children, so healthcare workers directly connecting with schools and into community centers and potentially even co-locating in some places. And we also think that there's a connection between social cohesion and some of that lower vulnerability. So we know that parents who feel supported and connected in their neighborhoods tend to feel better about parenting, and they also know that they have support. So I think there's a range of factors. It would be hard to pull one out as primary, but it's important to keep those others, not simply programmatic issues, but some of these broader spheres of influence that actually support families, particularly in raising their children.
Oh, that's great. That's great. And another question for you, Pippa, around the data sets that led to this. And how did you get the medical and educational records and data sets linked? There was a comment this would need provincial government support across ministries. So not a simple question, but how did that all happen?
Well, and that's a great question for Marni as well, because there are two different models in Manitoba and BC. I can speak about what we do here in BC, but I think in Manitoba they have an incredible model around data linkage as well. So in British Columbia, one of the things that happened when we started up the Human Early Learning Partnership was the creation of a sister organization, if you like, called Population Data BC. It's a specialist organization that houses and warehouses data sets and also provides the privacy and infrastructure for linking those data sets in a way that abides by all of the legislation that we're required to abide by. And so we have worked with them consistently over time. They store both our data, the data that I've referred to today here, but also they work directly with a wide variety of different ministries to store these administrative data sets, and then accesses through some regular sort of research channels that would be sort of held within ethics. But it's through an organization called Population Data BC. You can hop online and go and Google them. But I think, Marni, you may want to just talk a little bit about what you do as a counterpoint.
Sure. I would say the linkages in Manitoba have been happening since the 1970s. Nora Liu and Les Roos are really pioneers, not only across Canada, but around the world in terms of doing data linkage for research. And so, I kind of smiled when Pippa said everything abides by legislation. Of course, we do too, but when the Rooses began, there was no legislation. And thankfully, they had the vision and the foresight to see, we don't want to be able to identify people. We we don't want any names or addresses. So a system was set up so that information was stripped off at Manitoba Health, the Department of Health, before the data ever came into our repository. And that continues today. We never get any names or addresses. But over the years, we've expanded well beyond health databases. So we have all the provincial education. We have social services, family services like child welfare, income assistance. We now have justice data, provincial justice data, and of course education data. So linking those across sectors, it still is done through Manitoba Health as what we call a third party. So never for any of those data sets are there names or addresses, but they're all linkable at the individual level.
Okay, thank you. Before I do another question, I just want to let people know I put another polling question up. We got some really great answers about some actions at the community level. So now I wanted to shift it out a bit and see if there were suggestions around what we could do at the national, global level. And I'm particularly interested to hear from our, what I know are 2 international participants online, one from the Netherlands and one from Brazil. Certainly it would be really interested to hear your global perspective as well. So I'll leave that up for people to comment on. And then I've got a question for Marni and Mariette. Someone wondering about mom's literacy level. So was there an application to fill out and then a conversation to be had with a physician?
Is that for the healthy baby?
Yes, yeah, sorry.
Yeah, and that's a really great question. Literacy level, the application that they have to fill out does require some literacy level. There is assistance provided to women to fill out that application, but certainly, and we did adjust for mother's education level. That was one of the variables we were able to adjust for. But really good point that literacy level does have an impact on later outcomes.
And I know sometimes with some programs in other parts of the country, that sometimes there's arrangements made where the physician will verbalize an application or a support worker might verbalize. So there, in individual circumstances, there might be ways to sort of mitigate that. But a good point, right? And then was there any evaluation of how families spent the money, the supplement, the monthly supplement?
Yeah, and Mariette, feel free to jump in here too.
Oh yeah, no, you're doing a good job.
We did do a qualitative evaluation where we actually went out and interviewed women about, how did you spend the money. It's currently under review, but I can tell you that, and one of the things that I didn't say, but Mariette did touch on it, that this money is given with no strings attached. So there are a lot of programs kind of similar to it, but they always have conditions to get the money. So women are told, oh, you can have this money during pregnancy if you make so many doctor visits or if you come to this community support program. And when this program was developed, they felt that it was really important to give the money with no strings attached. And women who were interviewed said that that was important to them. And, some of them did spend it on nutrition. Some of them spent it on making rent, so they didn't have to move during pregnancy, which obviously would be a stress reducer. Some spent it on getting ready for baby, baby clothes, diapers. And some said they spent it on something nice for themselves so they'd feel good about themselves. But as I say, I think also knowing that, someone out there was trusting them to make the right decisions for themselves and their baby, I think goes a long way in terms of the outcomes that we saw for the kids of these moms.
Yeah, there's something about that, right? That trust and what that means for their self-esteem and their self-efficacy, and then how that then influences other decisions that are made in their lives too. I'm going to go to Pippa. There's a couple questions for Pippa, and they were when you were showing the slides around the multiple spheres of influence and the biological embedding and social epigenetics. So do you think the factors have equal influence on child development, and should we focus on ones that can be changed easier first or all of them at the same time?
I think that's a tough one as well, but my It's sort of shades of gray. I think that it would be true, and I'd be interested to hear Marni's take on this as well, that that paying attention to what we would call proximal or the close spheres of influence is powerfully important. The idea of parents feeling confident and able to nurture their children and be with their children and provide them with early learning experiences. Having said that, children also spend time outside the families, and families exist within a policy framework. And so in my mind, I think that paying attention to all of them at the same time is important. That simply working with programs that support families without actually dealing with issues, as Mariette and Marni have highlighted, of benefit or financial support to those families is probably going to be ineffective. So I try to hold the spheres of influence in balance and in focus at different times, depending on where you're able to get people to pay attention to. But I think they're all in some ways equally important. It's about a model of supporting in a holistic way all children and families.
Marni, did you want to chime in?
Mariette, do you want to crack at that?
Yeah. No, I was just going to say, Pippa, that's a wonderful answer. I think that's exactly what I was going to say. You know, they all have their influence, and the other thing is that, you know, policies influence the family, right? So we know that early childcare and learning, there's different systems across Canada and the world, so that of course influences you know, how parents, the stress level of parents, and the quality of that child care is really important for the child. So that's an example of you know, how policies on a provincial level can influence those closer, you know, those closer factors. But I would say that too. It's you know, you have to keep in mind all those factors.
I'm going to go to a question for Mariette and Marni. Was there professional contact throughout this study during that prenatal period? And can you describe it?
Professional contact, like with a physician?
It just
well, I guess you don't know because...
yeah.
They had to make the initial visit to a physician or a nurse practitioner, somebody who could write that medical note saying, yes, they're pregnant. And, you know, part of the goal was, okay, once you get women connected to prenatal, at least that first visit, that's sort of their door into prenatal care. But there was, you know, they didn't have to keep going to prenatal care. So for some there would have been professional contact, for some there wouldn't.
Okay. Okay. Interesting. Pippa, there's a question here for you, although you might have already shared the paper. So someone's wondering about a few words on the Socioeconomic Status Index, or send a reference to a paper which it covers. But did you share a reference to that?
I don't know if I did, but what I can do, maybe if we do a debrief call and we think about some of the other resources we could provide to people who've been on the call. We have just revised our SES, our Socioeconomic Status Index, which we've designed it specifically to be as predictive as possible of child vulnerability on the EDI, and we do show some very interesting patterns around those places that we would call on or off diagonal, communities that actually have vulnerability rates that you wouldn't normally expect given that kind of SES level. And I can certainly, the work has been done at Help by Dr. Barry Fora, and I can share that with everyone. And Diane, I'm going to have to hop in a cab and head down to my meeting. I'm really sorry to leave, and I'm so sorry to leave everyone on the line, but I'm really happy to provide any further resources and be part of another conversation.
That would be great. And, you know, if you send any links to me, Pippa, then I'm planning to follow up with all participants and share any resources and links with them. And I'll share the polling results with people as well and some of the ideas. So just send anything to me, and then everybody on the line can expect something from me in a couple of weeks.
Well, okay, and maybe you can just sort of nudge me on things that I may not have picked up, like things that particularly people wanted to see.
Sure.
Yeah?
Yep, that's
Great. Thanks so much.
Thank you,
Goodbye,
Pippa.
everyone. Thanks so much for being here.
Thanks,
Thanks, Pippa.
Okay.
Don't everyone
bye.
hang up, though. We're still carrying on.
A few more minutes.
A few more minutes, and I do want to let people know that there's another polling question up. I wanted to get at what people think some of those major risks and vulnerabilities to resilience and early child equity are. Sometimes when we try and identify what those risks and vulnerabilities are, it helps us to identify actions. So really looking for some good input here, and I'll leave it up. I do have a few more questions for Marni and Mariette. So for the, I've got the acronym, the HBPB, so Healthiest Babies Possible.
Healthy Baby Prenatal Benefit.
That's it. The acronym swimming around in my head. Close. So one of the indicators was breastfeeding initiation. So looking at exclusive breastfeeding, would that also be relevant, or was it the initiation piece the most critical?
Certainly it would be relevant, and in fact we would love to be able to look at breastfeeding duration as well. But with the data that we have in our repository, we only have one indicator of breastfeeding, and that comes from the hospital records. And for this study, they do in the hospital records split it out by exclusive or partial breastfeeding, but we combined both of those for any breastfeeding initiation for this particular study. Yeah.
I know it's when I was working in Ontario for a long time, you know, the research at that time and even some of the local stuff we did really indicated if people initiate, then they're more likely to continue. If they continue, they're more likely to do it exclusively. So it's sort of initiation is your most important first step to exclusivity. So I guess if you can only do one, then that's the one. So how do the outcomes compare to those of the nurse-family partnership?
I can try to answer that, and Marni, please feel free to jump in. So, you know, the overall answer is they are comparable. The nurse-family partnership, you know, we call it the Oles model because David Oles, you know, started this a long time ago and has done lots of research on it. So he and his team had basically found that nurses that do home visits have all kinds of really good outcomes for moms and for their babies. Our model in Manitoba, we definitely in the early 2000s looked at the nurse-family partnership. At the time there weren't enough nurses, and the cost was prohibitive for a province that didn't have the resources. So they came up with a hybrid model. I mentioned that they were paraprofessionals. David Oles had found that paraprofessionals had some impact on maternal and child outcomes, but lesser than the nurses. Our model is a bit of a hybrid. So the paraprofessionals, you know, so they're not nurses necessarily. They have ECD background maybe, or maybe some other post-secondary education, a little bit of nursing maybe, some beginning of teaching degrees or something like that. And some of them have at least their high school but have lots of parenting experience, so those are kind of the qualifications. However, they're supported by the public health system. So they meet 2 hours with a public health nurse every week for intensive and support and you know support. So they're not on their own. So I think that the fact that our results are consistent with the nurse-family partnership can be explained partly, I think, by the support that the paraprofessional home visitors get.
Yeah, no kidding. And then actually in answering that, you've actually answered another question about the qualifications and who those paraprofessionals are, so that's great. I'm going to ask one last question, and I also want to let people know I put on one last polling question. So the last one was identifying risks and vulnerabilities. So then what are some of those health promoting factors and those things that strengthen resilience and promote health and then therefore can help us identify what public health practitioners could do. So my last question then is is certainly not the last one on the list. There's been an amazing number of questions, which is great. One of the ones that I don't think we've talked about is the cost effectiveness of the interventions. And so the question is, were there any cost effectiveness measures collected in the evaluations? And Marni, you and I had a conversation recently about economic impact and economic evaluation of programs like this. So can you comment at all on cost effectiveness piece?
Yeah, I'll take 30 seconds to comment on Healthy Baby, and then Mariette can comment on Families First. But when we first started looking at this, we did what we called a back-of-the-envelope calculation. We're not economists. We're not really trained in doing the kind of return on investment stuff. But we did find it was cost effective. It's something that's kind of been on our list for years to do some follow-up and get some hard numbers in terms of what the return on the investment is for the Healthy Baby prenatal benefit.
Marni, do you need to add anything, or do you have anything?
No, Mariette, anything you want to say about the Families First?
Well, as you were saying, Marni, it's been on our list, and I think it's so important that we do this work because it really does help advocate to fund these programs if policymakers can see that it really is worth their investment. But the short answer is we have not done a cost analysis, and the question really is giving us impetus to look at that again.
Oh, that's great. And with that, it's 3:30 in Nova Scotia, 2:30 Eastern Time, and I think we need to end it there. So I want to thank Pippa in absentia here, and I knew she had to leave a few minutes early, and thank Marni and Mariette. I'm so excited with the level of participation and interaction among participants and fantastic questions, and it's been great